In this video, we will learn the technique of epi-retinal membrane removal. Triamcinolone is injected to stain the vitreous and PVD reduction is performed. Trypan blue is injected to stain the epi-retinal membrane. ERM removal is initiated from the most prominently stained area using multiple hold and release maneuvers of the ERM edge. The entire ERM is removed. Brilliant blue-green is injected to stain the ILM. We see that some part of the ILM has already been removed while ERM removal. In multiple small steps, the edge of the ILM is grabbed and it is removed. Surgeon may or may not prefer to remove the ILM after ERM removal. However, I personally remove it.